we will go over the use of CPAP in emergency medicine according to the Marion County Protocol. Candidates for CPAP. These patients will have persistent dyspnea or hypoxia. They may have a history consistent of heart failure, volume overload, COPD, or asthma exacerbation. These patients may have experienced drowning. And it is always the paramedic's judgment whether or not to use CPAP. How will these patients present? These patients will have an increased work of breathing. They may present in a tripod position. They may be cyanotic. You may also hear decreased lung sounds. Another lung sound that you may hear is crackles or rails. What is the criteria for CPAP? These patients must be 18 years or older. They must have the ability to maintain and protect an open airway. They must have a systolic blood pressure at or above 90. These patients also must have a pulse ox less than 92% on 100% oxygen, plus at least 2 of the following. They must have a severe or sudden onset of shortness of breath. Respiration rates greater than 25 breaths per minute. They will also have the use of accessory muscles and have dyspnea at rest. You will also hear rails or wheezing. This is the contraindications for CPAP. Do not use CPAP on any patient in respiratory arrest or cardiac arrest, any patient with agonal respirations, or ones that you suspect or confirm pneumothorax or penetrating chest trauma. Do not use CPAP on patients who are unable to maintain a patent airway, or any patients that may have impediment to proper mask placement or seal, such as facial trauma, stroke, or facial deformities. Do not use CPAP on tracheostomy patients. And please do not use CPAP on anyone who has persistent nausea or vomiting with upper GI bleed for the risk of aspiration. Patients who are unable to comply with CPAP due to severe anxiety or altered mental status should not be put on CPAP. Let's put this together. I will show you how to put CPAP on a patient.
So our patient here is presenting with inside the tripod position, and also he is breathing with pursed lips, which is giving a human form of the CPAP. For these patients, we're wanting to do the CPAP, and we will first put on the capnography. That way we can monitor his CO levels, and also we can give some more supplemental oxygen to him. You'll hook that up to your monitor and monitor his capnography. For the CPAP, we want to make sure that the bottom of the mask goes right below his lip and in that chin, and then we want to make sure that the sides of his lips are covered along with the top there of his nose. If it is too small, then you'll get a different mask, a larger one. If it's too big, obviously, then you'll get the smaller. But you want to make sure there's a small, medium, and a large mask adjusted to that person. First thing also, when you want to do that, you're going to let them know that it's going to make a lot of noise. This thing is not quiet. And you will use the high pressure valve on your bottle. Make sure that when you put this on, that you are very careful not to cross thread because it is just plastic. The other thing is selling this to our patient and having them help us with the treatment. So sir, I'm gonna start this CPAP. It's gonna be a little loud. When I get this going, what I want you to do is hold the mask up to your face, and that way you can take some deep breaths and start to get used to it, okay? So we have the CPAP going. I'm going to give this to my patient. And we will clip. And we will make sure that it is tight and adjust it where we need it so there's no air leaking. There may be a small volume of air that leaks where the capnography is, but other than that, there shouldn't really be any air leaking from there. And he's able to take breaths. How are you feeling right now? All right, so at this point, we're wanting to monitor our patients, making sure that capnography is good. You should see an increase in the pulse ox. If there's any change as far as decrease in pulse ox or more work of breathing, or if he becomes altered, you need to remove the CPAP. If he cannot keep his airway intact, we need to remove it. At that point, you will need to bag your patient. So I will remove this. It's just as simple. You can either pull from here and disconnect it, but you just take one off, and at that point, you can remove it from your patient.
Now I will show you how to put the neb treatment onto the CPAP. You will make the CPAP like normal, and you will fill up your neb treatment just like you normally would. Once your medication is in your neb treatment, you will open up the little blue port on the CPAP and attach the neb treatment. You will then attach the oxygen to the neb treatment. This ensures that the medication flows through the mask. Let's review. CPAP is beneficial for respiratory patients that meet the criteria noted earlier. Neb treatments can be used with the CPAP. Remember, continuously monitor your patient for any changes. Remove the CPAP if your patient's conditions get worse. And always remember, do not use on a patient who cannot protect their own airway. Thank you. Remember, right care, every patient, every time.